Spacers are used for all children who use inhalers, but do you know how to use them properly? Here's a breakdown of how to do it right. Why do we use spacers? We use them because it wastes less medicine, it helps direct it to where it needs to go. We have less side effects because it focuses on it going to the lungs rather than potentially causing oral thrush going around the mouth. And also it's easier for the patient to coordinate the timings of delivering the puffs of inhaler. What is a spacer? Well, you've got your metered dose inhaler that fits into the end of the spacer, and there's a universal end cap that it will fit into. And then you've got the spacer itself, which just is a chamber where the medicine can go through. And at the end of the spacer, you've got a valve which stops it flowing straight out. When the child takes a breath in, it opens the valve and allows the medication to go into the child. So how do we use the inhaler and the spacer? The first thing we're going to do is remove the cap from the inhaler, and we're going to prime it by giving 2 puffs away from anyone else. So just 2 puffs into the air. This is really useful if it's a new inhaler, or also if you've not used the inhaler in a while. Then you want to get the whole position ready with the inhaler and the spacer. So then you want to shake the inhaler to mix the propellant and the drug. So give the inhaler a shake. And then you're going to attach it onto the spacer. When you're positioning the patient and the spacer, make sure the valve is facing upwards. And if you can, tilt the child's chin and mouth slightly upwards, and that's to help direct the medication into the lungs. Then we want to position the child well with the patient. So in a baby, you're going to have the child lying sideways on the patient's lap with the parent facing the child. With a toddler, they can sit on the lap facing sideways, but they could also face away from the parent if the parent prefers this option, because it can be easier to hold the child and administer the medication that way. If the child's older and happy to do so, they can also stand up and face the parent while they do the medication. So whichever way works best for the child and the parent is fine. We can help when the inhaler is being administered in hospital, but it's actually better to show the parent and encourage them to be able to do it themselves, because when they go home, they're going to have to be able to administer it. So it's important to find a position and a process that works well for them. There's 2 techniques to using the inhaler. The most common one is to use tidal breathing, and this can be used either with a mask or no mask, but with the spacer and the inhaler every time. What you do with the tidal breathing technique is that just as the child starts breathing in, you press the inhaler to release the puff of medication. And then the child stays with their mouth around the inhaler and they breathe in and out 5 times. There's no need for them to hold their breath with this, so it's easier for younger children who are not able to do this. After they've done their 5 breaths, they can take their mouth off the spacer and wait for 30 seconds, and then they can do the whole process again with the next puff. You'll know that the child is taking breaths because you'll hear the valve click open and closed with each breath. If the child is taking breaths that are too deep or too fast, you might hear a whistling noise, so you know you can encourage them just to slow down and take it easy. Then we have the single breath technique. This is best used in older children, and it can be used with a spacer but without the mask. So in the single breath technique, the child takes a breath in, and as they take that breath in, they press the inhaler. They continue to take the rest of their breath in, and then they can take the spacer out of their mouth, and they hold their breath for 10 seconds or as long as they can. They can do the same for all the other puffs that they need to take. After we've done with the breaths, we replace the cap on the inhaler and the spacer and put them away. Parents should be advised to wash the spacer about once a week at home. They do this by soaking it in lukewarm water with mild detergent for 15 minutes, and then they rinse it well, and then it's left standing up to drip dry on their rack. You shouldn't use a cloth to dry it, because otherwise you'll get bits of fibres on it. The spacer should be replaced every 6 to 12 months. If you enjoyed this video, you'll enjoy my video on top 5 fever myths, which you can see here.